Welcome to this edition of Remarkable Conversations, a series that brings together voices driving impact across cardiovascular medicine. I'm privileged today to be joined by Drs. Dipti Itchaporia, Hani Najm, and Benny Levinson for a dynamic discussion about a topic of urgent and growing importance: how we're advancing cardiovascular care worldwide through ACC's global strategy. Cardiovascular disease continues to be the leading cause of death across the globe, with disproportionate burdens in low and middle-income countries. The data is clear. CVD is a global challenge that requires a global response. And at the ACC, we strongly believe that improving heart health worldwide means acting not only with bold ambition, but with localized insight, partnerships, and long-term commitment. That's why the college's global strategy is designed to meet clinicians and communities where they are, through tailored education, collaborative quality improvement, leadership development, research investment, and global health advocacy. Today, you'll hear how these strategic pillars are translating into real-world action. We'll also talk about where we're headed and how ACC members, wherever you are, can be a part of this mission. With that, let's get started. Let me introduce the other panelists. With me today is Dr. Dipti Itchaporia. He's an interventional cardiologist in Southern California and a past president of the ACC. Also with us today is Dr. Benny Levinson, who is an interventional cardiologist from Berlin, Germany, and chair of the Assembly of International Governors. Also with us is Dr. Hani Najm, a world-renowned congenital heart surgeon at the Cleveland Clinic, and is also a past chair of the Assembly of International Governors and a present member of the Board of Trustees. Welcome all. So let's start with a discussion of the global educational activities of the ACC. In what ways is the ACC providing tailored, localized education around the world?
Well, I'll start and just say, ACC's always been deeply committed to localized education and capacity building. And we do that in many formats. We believe that not one size fits all. So we have to do education in a localized fashion. I mean, we have our regional meetings in the Middle East, South America, and that. So those are some examples. Recently, we started to do the Weight Management Masterclass series, which has been a very impactful initiative where we deliver across 4 regions: Latin America, the Middle East, Oceania, and Africa. And what made this program stand out is not that it's just evidence-based, but it's the way that it's designed to cascade through local care systems and hopefully reaching up to 200,000 patients. So that's what we want to do, is we want to reach the patients, and that's one example. We're just having an echo training session that's going to happen in Kenya coming through. So again, bringing it to the local places. So, but I'll let our International Assembly of Governors talk about the international regional conferences, but those are some other examples. So maybe Benny or Hani want to talk about those.
Yeah, I think we have a very strong, thank you for focusing on the regional conferences, because as you said, education is tailored. We are facing different situations if it goes to Europe, we're talking about Europe or other parts of the world. And we just had an incredible, successful international regional conference in Asia, which recently had over 1,000 attendees and over 400 abstract submissions, and this was very well received. I think it was the best regional conference ever in that region. So we're reaching out to people, and we're getting a response from there. Hani.
Yeah, I agree. And since COVID-19, there have been a lot of shift of how we communicate and how we deliver knowledge and education. And certainly reaching out to our members globally has been a strategy of the ACC. So we know and we realize how difficult sometimes it is for our members to come to the United States for many reasons. However, the ACC have zoomed down on how can we reach to our members globally. And that's where the different regional conferences play a major role on how the ACC reaches out to our members in different continents. Therefore, we could reach out, we talk, we discuss, and at the same time, we deliver the ACC Best of ACC to our regional conferences. So, and this is also a two-way communication. We do learn also from our global partners around the world. It's a two-way where we listen, we hear what are the sciences that are latest of the sciences that has happened everywhere else. And at the same time, we could deliver what has been the best of our scientific sessions in the annual meeting. So this has been an incredibly fruitful way of reaching out to our members, in addition to having to hear and listen to our members and our friends they've become as we reach out to different parts of the world.
And if I could add that we also participate in meetings all over the world. The presidential team and the board of trustees members travel to the national meetings of many countries.
Yeah, over 50. I mean, you know this very well from being president and then board of trustees. And then I want to mention one other educational thing that I personally love is the NCD Academy that we have, which is a free, on-demand, multilingual education. And it was one of the efforts to do capacity building all over the world. And so this is available for free to anybody that wants to learn about cardiovascular medicine, and it's updated regularly with different modules to really up the game in terms of cardiovascular education.
Great.
Yeah, and what Chris was pointing out just now is that we are showing, we are visible in these regional meetings. We just came back from Cardio 25 in Alexandria in Egypt, which is the largest cardiology meeting in Africa. And ACC was there very strong with a strong team and bringing our mission forward, because we should never forget we have the global strategy plan, and the mission is to improve cardiac care globally. And so these are the best opportunities to bring the ideas, bring the education ACC stands for to different parts of the world.
So I want to turn now to a discussion of the global quality initiatives. Benny, do you want to mention some of the things that the ACC brings to global quality?
Yeah, I think it's important. You know, it's one of my most favorite babies. Under the leadership of Hani Najim as a chair of the AIG, we started the first global program bringing the world together, and it's the Global Heart Attack Treatment Initiative, which started in Q1 2019, and we started with 7 centers in 5 countries. And meanwhile, we are up to 54 sites in 27 countries, including over 14,000 STEMIs. And from the first data, which we published at the beginning of this year, we could show that alone by taking part in this initiative, you improve the STEMI care in many regions of the world. And this project was aimed especially for low and middle income countries. So that's one initiative we started. Another one is the Global Quality Solution Program, including NCDR, as Dipti mentioned, partnering registries, accreditation services, international centers of excellence. And momentarily, ACC is running over 45 products in more than 13 countries. And again, countries like Saudi Arabia, UEA, Australia, South Africa, Botswana, Vietnam, India, Pakistan, Ukraine, Brazil, Mexico, Canada. It's the globe where we're present. And the goal is to focus on partnering with hospital systems and ministries of health. And partnering with ministries of health, working together with ministries of health. We started some years ago. There's a very close relationship to the Minister of Health in Saudi Arabia. There have been a lot of meetings. We are also working very strongly together with the regional minister of health in the province of Sao Paulo in Brazil, who signed a decree some time ago that all 54 cath centers in the region of Sao Paulo, we're talking about 44 million people, should join our Gati project, which would be an enormous step forward again, a leap forward in quality improvement with this quality assessment program ACC is running.
Yeah, that's great. And we actually within the last couple of weeks had a meeting with the Minister of Health in Singapore and are developing a relationship there around implementing AI and basically new ways of informing care in Singapore and the US. So we can learn from them and they can learn from us.
I have to say, Chris, the leadership of the ACC together with the AIG has actually made an incredible progress by moving forward and to meet the ministries of health in different parts of the world. And specifically, if you look at how much can you impact when you implement a quality project like the NCDR in any of the hospitals, and especially if you do that at a national level of any country with implementing this in multiple hospitals, impact is magnitude more than just delivering science. Now this is direct patient care, improved quality. This is impacting global cardiovascular disease around the world. It is of magnitude of difference than just talking about the clinical trials, which is important, and the advancement. This is actual patient care. And once you implement the quality project like the NCDR, you know this has been studied again and again. You know that you're impacting patient lives. And imagine how many patients' lives you improve or you save by implementing these quality metrics. I think this is an incredible step of the ACC towards impacting the patients globally.
And it's of interest for every decent politician to see, and that also others see, that patient care is improved in their countries. That's what they're interested in directly and personally. So you get the two sides of benefit for the patients and as well for the countries and the politicians.
Terrific. Well, I'd like to turn now to a discussion on global leadership development and research support. There are a number of awards that the ACC offers, and Hani, maybe you want to speak to that. And the Global Leadership Institute, for example, that brings young leaders from around the world to the Hart House every year.
Exactly, Chris. So we did talk about how we can impact education to the cardiologists within the United States and globally. We did talk about how we impact patients by the NCDR and the quality metrics. Now we're talking about developing cardiovascular leaders around the world. And this is an incredible, again, project that has been developed by the ACC, where we're truly empowering leaders in our specialty by bringing them in the Hart House, where they can join the Global Leadership Academy and as well attend the annual meeting and be at any of the leading cardiovascular centers in the United States. So this is a way of exposing international leaders to how does it look to become a leader in cardiovascular medicine so they can evolve in their career. So not only that we're impacting their scientific and education, but also in addition, impacting their actual career, developing their career, exposing them to the highest level of cardiovascular medicine within the United States so they can come in and see firsthand how can they get, and also they get an intensive course on leadership and what does it take to become a leader in their field. And this actually brings us down to the research areas, which the United States is a leader in cardiovascular research, in addition to major partners in the world. So there are a number of awards that are also geared towards research, such as the Zogby Award and the Jamal Rana Cardiometabolic Health Global Research Award. These are for emerging faculties also, and Wael Al-Mahmoud dedicated to Young Leaders Program. So early career, who are interested in research, they also can get an exposure. So these are also tailored for this. There are the announcement, there are deadlines and committees who could choose who would come in, but it is an incredible opportunity for our early career cardiologists and surgeons who would want to come and join these awards.
And we would be remiss if we didn't thank Hani Najm for endowing the Hani Najm scholarship for young leaders in Middle Eastern countries to come observe cardiovascular care in the U.S. as well.
And can I mention something about the Global Leadership Institute, because I have been part of that Global Leadership Institute for a long time. And I will tell you that we have 44 international chapters in the ACC. And one of the benefits with these chapters is they can nominate an early career person to be part of this program. And I can tell you year after year that what we get back from feedback from this group is that they want to be part of this, and they go on and tell other people, because they say they get an opportunity, first of all, to visit the Heart House, to learn about leadership skills, all of the non-clinical competencies that they never get. But those are the things that help them to succeed in whatever career path that they take. So I agree with Hani. It's a really important piece of what we do in terms of the emerging pipeline of leadership across the world.
I think we're developing governors of the ACC in these other countries even 5 and 10 years down the road. So it's a great opportunity for them, and it's a great opportunity for the ACC.
Absolutely.
So I want to turn.
This was a great remark, and I couldn't more than agree, because this shows the importance of the ACC as the center of global cardiology, and for the individuals. ACC is the professional home, and at the end of the day, the success of our mission depends on these young cardiologists and the cardiologists all over the world to get to the goals we have.
Great, thank you. So we're going to turn now to a discussion of global health and some of our involvement with the World Heart Foundation. I know, Dipti, you've been on the board for several years there, and how does the ACC work with WHF?
Well, first of all, I would say ACC has played really a vital role in addressing global advocacy, to address the rising burden of non-communicable diseases, right? And cardiovascular disease is that. And so through our strong partnership, not only with the NCD Alliance, but with the World Heart Federation, what we really have done is to really raise our voice in terms of global advocacy, specifically targeting cardiovascular disease. And I think that's been a really important thing. I think we made a deliberate, conscious effort to say that we want to be part of these conversations. We want to be at the table. So I think Hani mentioned the fact that we've met with all of these health ministers. Some of that has been the opportunities through these partnerships that we've been there. We've gone to that World Heart Summit for a number of years to be part of these conversations. And so I think the college's approach is that we want to take evidence. We not only want to do evidence generation, but we want to do policy engagement, and we want to do capacity building. And I think our global strategy sort of addresses all of those things.
Yeah, I think just to mention as well, in addition to attending the World Heart Summit, we've been participating for me the last 2 years in the UN General Assembly and the side meetings around non-communicable diseases, because in 2025 that's going to be the focus of the UN General Assembly, and a focus on non-communicable diseases, especially cardiovascular disease, which remains the #1 killer around the globe.
Absolutely, and think about the polypill, right? That's a good example of the fact that we have really amplified the findings of the polypill. And with the recent FDA approval of a polypill, we've sort of said that we're behind this because we know that that can potentially be a huge milestone that aligns with the World Health Organization's essential medicine strategy. So I think that we have been front and center being involved with this because we realize that we need to have that voice.
Dipti, I have to agree with you. I feel that Now we've got even a bigger responsibility than a few years ago. We've seen trends of decreasing cardiovascular disease a few years ago, and now we've got this resurgence of cardiovascular disease burden. And this is something that now it impacts whatever the reason why it is not actually, we're not achieving the targets that we wanted or we hoped for. So I hope that these initiatives that we're doing with the ACC and all the clinical trials that we have, we're able to achieve some reduction of cardiovascular disease around the world. It is certainly the number one, and it's going to probably continue for many years to come, unfortunately. However, the responsibility continues on us and all the cardiovascular practitioners around the world to try and improve on the burden of cardiovascular disease.
And I'll say one other thing with the World Heart Federation. They put out these roadmaps, right? So they had the hypertension roadmap. And what we did was help amplify the voice of that roadmap by saying, because obviously hypertension is a key risk factor that we also believe in, and we haven't gotten that message out. So we've learned to work with these partnerships to really get the message out in multiple different venues and avenues. I mentioned the NCD Academy before because we do think that capacity building is important. The other thing is, I will say that I think the conversation at the ACC has been about innovation as a way to scale some of the bigger issues in terms of access and all of that. And so I think that our global advocacy policies have been not only, we talk about prevention, but we're talking about equity and we're talking about innovation, because we think that all of those pieces have to be there if we're going to scale all of this on a global level.
Thank you for that. So looking ahead, how can ACC members get involved in global initiatives? What are first steps?
Well, first of all, I would just say there's so many opportunities to be involved. So I think if I were an international member, if you're a fellows in training, you get free membership to ACC. But you could join your chapter. If there's an international chapter, join that. I think there are sections. We have 25 sections. So if you have an interest in heart failure, you can join the heart failure section, cardio-oncology, imaging section. There's all kinds of sections that you can get involved in so that you can be part of that. You can apply for a committee. There's all these committee cycles every year. So that's another opportunity. We mentioned the regional conferences. If you can't travel, go to the regional conference. There's obviously the ACC national conference that you can get at. But those are some of the ideas. I'd love to hear what Benny and Hani have to add.
I would say, Dipti, the key word to whatever you said is engagement. Engagement of all the domestic and international members. You have so many avenues of being engaged with the college through the early career, through the leadership, through participating in regional conferences, in the annual meeting, submitting your science, coming into the meeting. It's all about engagement, and by engagement, we are able to decrease the cardiovascular disease. Bringing in your administrator, as a matter of fact, if your hospital come in and see what the ACC can offer, bringing your administrator to look at what the quality projects that we have, whether you are within the United States or you are a global member. A lot of this it's all about engagement of through all these avenues, whether it's through science, through education, through leadership, through research. All this is actually are opportunities for engagement. So I think, and it is on us, the cardiovascular practitioners, to bring in the cardiovascular disease burden.
And engagement is an everyday work, which means we build up at the Assembly of International Governors, we build up a structure that it's the task of the governors elect to engage with their fellows, with their members in the regional chapters. You mentioned that we have 44 international chapters now. We're about to get the chapter number 45 on board, because Nepal has reached the margin of 20 FACCs. So that's where the work starts. That's where the grassroots movement of cardiology starts, to get young people interested. I was to a meeting in Serbia just in March of this year, and it's incredible to see how much young, mostly female medical students, interns, early careers cardiologists are interested in learn from ACC, get educated, get engaged in international programs. And we have a very strong branch within the ACC, that's the young cardiologist. And as you know, Monica Vadoia from Italy is one of the speakers, and she's very active. So that's the way to get young people interested in what ACC does, being interested in patient cares globally. And I think that's the best point to start and to increase the effect of what we are doing.
And just a reminder to potential international members that membership in the ACC is free for those under 40. That includes any physician or APP, administrator, et cetera, under the age of 40. International membership is free. So I want to close by first thanking Dr. Najim Levinson and Ichaporia for your time, expertise, and dedication to advancing cardiovascular care on a global scale. What we've heard today is both inspiring and reaffirming. The ACC's global strategy is not just a roadmap, it's a movement rooted in partnership, cultural respect, scientific excellence, and a belief that every person in every corner of the world deserves access to the highest quality cardiovascular care. As we look ahead, the invitation is open. Get involved, stay engaged, and help us expand this impact and even further. Whether it's through mentorship, research, policy, advocacy, or on-the-ground implementation, there's a role for everyone in this journey. So as we close, please join me in raising your glass to global collaboration, shared purpose, and improved heart health for all, to action and to impact. Cheers.
Cheers.